Have you ever woken up in the middle of the night with excruciating pain in your big toe, as if someone had stuck a needle in it? Oh. Or perhaps you've noticed that your joints are sore even without exerting yourself. This may not seem like it, but this could have something to do with something called uric acid. And what you re-eating could be fueling this problem without you even knowing it. Today, you'll discover exactly what happens in your body when uric acid levels get too high, which foods make it worse, and how to prevent gout attacks before they start. What is uric acid anyway? It's a byproduct your body creates when it breaks down purines, natural compounds that are part of DNA, RNA, and even energy production. Your body produces purines naturally, but they also come from food. And that's where the problems begin. Normally, uric acid dissolves in the blood, passes through the kidneys, and is excreted in urine. Simple, right? But if your kidneys can't eliminate it all, or you're eating too many purine-rich foods, uric acid starts to build up in your blood, causing a condition called hyperuricemia. Now pay attention to these numbers for men. Your blood uric acid level shouldn't exceed 8.6 milligrams L. For women, the limit is 7.1 milligrams L. Above that, you're officially in risk territory and possibly on the verge of gout, kidney stones, and even heart and metabolic problems. About 20% of the American population is dealing with hyperuricemia right now, and many do, and even know it. But what actually happens when uric acid builds up? It crystallizes. Yes, like tiny microscopic needles that accumulate in your joints. And these needles literally pierce your immune cells, causing a massive inflammatory reaction, hence that extreme joint pain. The most common form? Gout, which usually attacks the big toe, but can appear in the ankles, knees, or even the hands. These crystals can also end up in the kidneys, where they form stones that cause even more pain. Over time, if left untreated, excess uric acid can lead to permanent joint and bone damage, chronic kidney disease, high blood pressure, type 2 diabetes, and even fatty liver disease. But here's the good news. You can control this with simple dietary changes. The key is to avoid foods that most increase uric acid, and that's exactly what we LAA look at now. So here's the list of the 10 worst foods for those with high uric acid or wanting to prevent gout attacks. 10. Red meat, beef, pork, and lamb, especially lamb, are high in purines. 9. Purine-rich fish. Herring, tuna, mackerel, sardines, and anchovies are the biggest culprits. Salmon is a low-purine alternative and generally safe. 8. Game meats, venison, quail, pheasant, goose, rabbit, all have high levels of purines. Choose chicken skinless, and always with plenty of vegetables. 7. Scallops and seafood. Scallops should be avoided. In small quantities, shrimp, lobster, and crab can be consumed. Ideally, you should keep seafood to less than 230 grams per day. 6. Organ meats, viscera. Liver, kidneys, brain, tongue, all are extremely high in purines. Avoid them completely if you've had gout attacks. 5. Beer and alcoholic beverages. Beer contains purines from yeast, and alcohol interferes with the kidney's ability to eliminate uric acid. Even wine and spirits contribute to more uric acid in the blood. If you already have gout, alcohol is a sure recipe for pain. This ingredient is everywhere. Soda, juice boxes, energy drinks, sauces, cookies, candy, toast directly increases uric acid production. Avoid fast food, processed desserts, and snacks. 3. Certain vegetables and legumes. Spinach, cauliflower, peas, asparagus, mushrooms, and legumes like lentils and dried beans contain purines, but in general, they aren't as problematic as meats. Still, if you already have gout, moderate your intake. 2. Fruits high in fructose. Peaches, mangoes, kiwi, dried apricots, persimmons, and figs should be consumed in moderation. Choose fruits like cherries, berries, pineapple, oranges, papaya, and apples, which help reduce inflammation. 1. Excessive whole and refined grains. Yes, even the healthy ones. Oats, bran, whole wheat, they all contain purines. Additionally, foods with gluten and a high glycemic index, like white bread and pasta, increase inflammation. Moderation is key. Now, a common question. What about dairy? Should they be avoided? Actually, no. Milk, cheese, and yogurt are low in purines and can help eliminate uric acid. They're allies, not enemies. And here's a bonus. Foods like desserts don't directly cause gout, but they contribute to weight gain, which greatly increases the risk. Obesity is one of the biggest risk factors for gout attacks. If you want to monitor your uric acid levels at home, there are blood uric acid meters that work like a glucose meter. In the description, we've included a link with recommendations. And in the next video, we'll talk about the best foods to lower uric acid naturally. So subscribe now and hit the bell so you don't miss it. Did you like the video? Like it, share it with someone who suffers from joint pain, and let us know in the comments. Have you ever had flare-ups? Are you controlling your uric acid? It's what worked for you. Remember, this video is for educational purposes only and does not replace medical advice. Consult your healthcare professional for proper diagnosis and treatment. Until next time, take care of yourself because you're worth it.